The most important thing, and I think for the severe patients, is that when they bleed, they get their treatment. That is the most important thing.
Mila was fine until the Christmas Eve of 2009. He started crying, and we did not know what was wrong with him, so he was taken to the doctor. The doctor took him to a local hospital, and the local hospital couldn't handle it and referred him to another hospital in Butterworth. In Butterworth, they diagnosed him with meningitis and treated him for 2 months for meningitis.
The most dangerous thing about hemophilia is patients who have head bleeds, and I think that could well have affected him in the beginning. So that meant that he bled inside his brain, and then obviously there's scar tissue, and then obviously that caused the fits and everything else before he was probably diagnosed. So that's, I think, the importance of early diagnosis. I think the parents are well aware that something is wrong, and they may go looking for help, and they may not end up in an expert clinic or somebody who realizes it, and they may say, they may say, oh, but this child is covered in bruising, because obviously they bleed, so they'll bleed into muscles and joints, they'll bruise easily. So, maybe it could be confused sometimes with abuse.
When he got to East London, the doctors did scans and discovered that he was bleeding in his head, and there was also a fluid built up in his brain. So they diagnosed him with hemophilia, but they also told my mom that he wouldn't live past a year old.
So hemophilia is an inherited genetic condition in which the females are the carriers and the males are affected with the condition. So the males have the gene, and the gene basically carries the information for the clotting factors. So in hemophilia A, he is missing clotting factor number 8. It means that he actually has no clotting factor in his blood, because there are varying severities of hemophilia. So you can be severe, which he is, which means has no factor 8 at all, or you can be a moderate patient, which is clotting factor 8 of 1 to 5%, and then mild patients have clotting factor 5 to 40%. Normal people have clotting factor of 50 to 100%. So without this clotting factor, your blood will not clot. So I think it becomes a basic way of life, that you live your life with your hemophilia, but you are able to do what everybody else does in the community. So if you manage your condition, then you're not going to have a problem in your daily life.